Greetings everyone. Today, we're delving into the world of a medication known as Duopa, with its generic name being Carbidopa and Levodopa enteral suspension. As always, our discussion is for educational purposes, and if you have any health-related inquiries, it's essential to seek guidance from a medical professional. Description: Duopa, known generically as Carbidopa and Levodopa enteral suspension, is a unique medication administered directly into the small intestine via a surgically placed tube. This medication combines two active ingredients, carbidopa and levodopa. Carbidopa helps prevent the breakdown of levodopa in the bloodstream before it can reach the brain, where it's converted into dopamine, a neurotransmitter essential for regulating movement and coordination. Duopa is primarily prescribed for advanced Parkinson's disease, a progressive neurological disorder characterized by the depletion of dopamine-producing cells in the brain. By providing a continuous infusion of levodopa-carbidopa gel, Duopa aims to manage motor fluctuations and alleviate symptoms such as tremors, stiffness, and slowed movement commonly associated with Parkinson's disease. It's important to note that Duopa is typically recommended for patients who have not responded adequately to standard oral medications for Parkinson's disease. Warnings: Duopa comes with important precautions. It's not suitable for everyone and should not be used by individuals who have narrow-angle glaucoma, a history of melanoma, suspicious undiagnosed skin lesions, or hypersensitivity to levodopa, carbidopa, or any component of the formulation. Additionally, Duopa is not recommended for patients with severe cardiovascular or pulmonary disease, asthma, or a history of dyskinesia, involuntary muscle movements, induced by levodopa therapy. Before taking this medication. Before initiating Duopa therapy, it's crucial to discuss your medical history and current medications with your healthcare provider. Inform your doctor if you have any allergies, especially to carbidopa, levodopa, or related medications. Since Duopa requires a surgical procedure for tube placement, it's essential to evaluate the risks and benefits of this treatment approach, particularly in older adults or those with significant medical comorbidities. Regular monitoring and adjustments to the Duopa infusion regimen may be necessary to optimize therapeutic outcomes and minimize adverse effects. Side effects: like any medication, Duopa may cause side effects. Common adverse reactions associated with Duopa include abdominal pain, nausea, constipation, diarrhea, orthostatic hypotension, low blood pressure upon standing, dizziness, headache, and fatigue. It's essential to report any unusual or persistent symptoms to your healthcare provider promptly. In some cases, Duopa infusion may lead to device-related complications such as tube dislocation, blockage, or infection at the insertion site. Patients should be vigilant for signs of infection, including redness, swelling, warmth, or drainage around the tube, and seek medical attention if suspected. Interactions: Duopa may interact with certain medications, including monoamine oxidase inhibitors, MAOIs, antipsychotics, and antidepressants, potentially leading to increased side effects or reduced efficacy. It's crucial to inform your healthcare provider about all prescription, over-the-counter, and herbal supplements you're taking before starting Duopa therapy. Dosage: the dosage and administration of Duopa are highly individualized and determined by factors such as disease severity, response to treatment, and tolerability. The Duopa infusion system delivers a continuous supply of carbidopa-levodopa gel directly into the small intestine over a 16-hour period using a portable pump. Healthcare providers will adjust the infusion rate and duration based on the patient's needs, with the goal of achieving optimal symptom control while minimizing side effects. Regular follow-up appointments are essential to assess treatment response and make any necessary adjustments to the Duopa regimen. Avoid: to optimize the effectiveness of Duopa therapy, patients should adhere to their prescribed infusion schedule and avoid interruptions or missed doses. It's essential to maintain proper hygiene and care of the enteral tube to prevent complications such as infection or occlusion. Additionally, individuals receiving Duopa should be cautious when driving or operating machinery, as the medication may cause drowsiness or impair motor function. FAQ: patients often inquire about the long-term safety and efficacy of Duopa therapy. While Duopa has demonstrated effectiveness in managing motor fluctuations associated with advanced Parkinson's disease, long-term studies are ongoing to evaluate its impact on disease progression and quality of life. As with any treatment, it's essential to discuss the potential benefits and risks of Duopa with your healthcare provider. Closing: that concludes our overview of Duopa. Remember, this information is intended for educational purposes and should not replace personalized medical advice. If you have any questions or concerns about Duopa or Parkinson's disease management, don't hesitate to consult with a qualified healthcare professional. Thank you for joining us today.